Access to health care has become more problematic for many rural communities, and that's why Texas A&M Health is launching a program to improve health care delivery in those areas. It's launching the Rural Engagement Program, and joining us now is Dr. Parsi, Executive Director of the Rural and Community Health Institute. Doctor, thank you so much for being with us.
Oh, I'm very happy to be here, Jennifer.
So let's talk about this program. You all received funding from the 88th Texas Legislature. How will those dollars get put to use? We know that rural health care is something that many people lack access to. So how will you all help with that issue?
Oh, sure. Yes, as you mentioned, rural health care, access to health care in rural communities has been a challenge nationwide, but especially in Texas. More than half of the counties in Texas are rural. The Texas A&M University, as a land-grant institution, has always been supportive of rural communities and specifically rural health care. This program is actually a program that involves three different institutions, which is within Texas A&M, the School of Medicine, School of Nursing, and the institute that I'm the executive director of, the Rural and Community Health Institute.
And so now we know that one of the problems within healthcare, whether it be urban or rural, is the shortage of healthcare workers. And it seems like this program will directly address that, making it sustainable.
Sure, yes, especially in rural communities. If you think of a community that has 3 or 4 physicians, advanced practitioners that are seeing patients in the entire community, and they lose one practitioner, well, that's a quarter of the entire workforce. So small changes can make big impact on these rural communities. What we're trying to do with the School of Medicine, School of Nursing, is encourage their students to consider rural communities for once they finish their education and graduate. We've had medical students that are from more urban areas that do a rural elective, and now they're going to consider a rural community for their future when they wouldn't have considered it otherwise.
And what also is interesting is that not only are you working with students who are now in higher education, but you're also working with students who are younger. So really inspiring the next generation of healthcare workers.
Yes, I think this is unique where you have a world-class academic institution, Texas A&M, working directly with local school districts in rural communities to create a pathway for these elementary kids, high school students to consider healthcare for the future. We know that the most likely individual to work in a rural community is someone from a rural community. So we think that's the long game. The short game is our current students at our medical school and School of Nursing, but the long game is how about these elementary and high school students in these rural communities? We want them to know that healthcare can be an option for them.
And then lastly, Dr. Parsi, can you just talk about the greatest challenge, the greatest need when it comes to rural health care and how you all hope that this new program will address that need?
Well, I would say there are two main challenges, and we've already addressed one of them, and that is workforce. You have to have the clinical expertise to provide the care in the rural communities, and you want to be able to recruit highly trained individuals in healthcare to work in rural communities. I think that's a huge challenge. The other one is just the economics of viability for rural healthcare institutions, clinics and hospitals. And that's the second major component of the Health Rural Engagement Program with Texas A&M. Our institute is going to provide expertise on hospital and clinic operations to ensure that they can keep their doors open and provide access to care for our communities.
Dr. Parsi from Texas A&M, thank you so much for joining us this afternoon.